Hi everyone, welcome back to my channel. My name is Dr. Huynh. I'll be talking to you about the topic today is the non-invasive single tooth implant placement. How do you place an implant for a single tooth without any traumatic experience for the patient? Uh, it's all about case selection. Let's talk about the criteria and how you go about to do this type of procedure for your patient. Check out the case today. Tube number 14 missing. The sinus floor, as you can see, patient have about 9 millimeter to 10 millimeter distant from the crestal bone level to the sinus level, which is pretty nice bone high for a single tube implant, especially the sinus upper arch case. So in this case, definitely a good case. The tissue thickness is about 3 millimeter. That is a soft tissue thickness. Really nice case to perform non-invasive surgical approach scenario. And in this case, I already numbed the patient. You look at the occlusal view, very thick bone buccolingually, and also the gum tissue seems to be really thick. This is a good case for a non-invasive procedure. You don't have to flap the case, open up and place the implant. Of course, you can do that way too if you want. Or refer your reference. If you feel comfortable, you do what you've been doing. You do what you want to do. In this case, I'm using Nobel Biocare conical connection surgical kit. Quite simple. 3 different color: blue, yellow, and red or purple. Beautiful set of surgical kit. Again, evaluate your patient mouth, occlusal view, evaluate TMJ, evaluate medical history, occlusal view, opposing arch. Make sure that you see any kind of contraindication, such as occlusal interference, stuff like that. You have to pay attention to the restoration, final restoration. How is that going to affect your patient chewing, eating, long-term stability of the implant? All of that should be put in consideration. This is a nice case. I will be talking about how to start it. In this case, we're using 4 different drills. Drill number 1 is 2 millimeter diameter, go down about 8 millimeter depth. Take an X-ray, evaluate the angle, buccolingually, mesodistally. Make sure all of the angle in 3 dimension perfectly align according to what you wish to have the implant go into for. You'll be seeing me showing you the X-ray in just a second. So again, look at the angle. The angle is very critical. You should be able to see all the diameter dimension before you continue. Take a look at my initial pilot drill with the 8 millimeter going to the tissue all the way to the bone. It's almost like you got 3 millimeter of the soft tissue and 5 millimeter of the implant. Remember I told you about the bone height, total about 9 to 10 millimeter diameter, millimeter. So 4 drill number 1, 2 millimeter diameter, number 2, 3 millimeter, number 4 millimeter, number 5 millimeter, and the implant diameter is 5 millimeter. Again, simple step. When you doing this, you need to have a stopper. So when you drill, you know exactly where you go in. Each of those drill have the mark is indicate 5, 10, 5, 8 millimeter, 10 millimeter, 12 millimeter, very clear. So you need to know where you want to go before you continue. After the implant final birth trial, tissue punch were finishing with a very small punch of soft tissue, about 5 mm diameter. We place the implant with the hand torque range, go all the way to the crestal bone level, check with the explorer and see the margin of the crestal bone is right at the edge of the implant, or 1 or 2 millimeter below the implant. The bone height is what you want. And in this case, I did double check, and now we place the Huynh abutment right on, because the implant were really strong and thick and firm, more than 35 Newton centimeter. I was able to place the Huynh abutment right on this case, no bleeding. Take an X-ray. This is how it looked. The implant went 0.5 millimeter to 1 millimeter below the crestal bone, close to the sinus, and which is exactly what I predict. And patient should be feel okay. We did the nose test and everything before. Patient didn't have any nose bleeding, nose or bleeding come out from the socket before we did this. All was in one step. And this is the final photo. Simple case. Thank you for watching, you guys. I hope you enjoyed the case. You have any more questions, feel free to comment on this video. I'll be happy to answer you. Again, this is for general dentistry, or dentists who want to do implant with non-surgical way. Of course, we can talk more about the flap technique. I'll be showing you another case with the flap technique. Thank you for watching again. Have a good day, guys. Bye bye.